I was coming as a child and now I'm bringing my own children.
With Zufall, I found myself respected and welcomed.
This is a story of a special place that helps people stay healthy and lead good, productive lives. Some of them are young.
I really like my doctor because he understands me.
Some are older.
We have Zumba, we have yoga, we learn how to keep healthy.
Compassionate, knowledgeable, old-time care, and you just know you're going to be taken care of.
And most require care that exceeds their resources or insurance, if they have insurance. But none of that matters at Zufall. All of them, some 30,000 a year, get quality care from a team of physicians, nurses, and other professionals who are passionately dedicated to improving the lives of others.
This is a tremendously rewarding place to work. The population that we deal with is unbelievably rewarding. It is, by and large, the working poor and their families.
I love working at Zufall because I can take better care of patients here.
A lot of the patients that come here would not get care if we didn't exist.
Stephanie's a kid that we've taken care of for 4 or 5 years now here. She came uninsured, and she's a kid who has a rare genetic condition. So it took a long time to get her ultimately insured.
I was having trouble in school.
The result here is that Stephanie has been able to get 2 surgeries done at Children's Hospital of Philadelphia. She is now getting growth hormone treatments. She's seeing a cardiologist. She's seeing all the specialist needs. So she gets her dental care here. She comes here for her regular medical care. She's doing wonderfully.
School is easier for me now. I feel like now I'm more of a normal kid.
Their stories are all part of another story, one that began 25 years ago when Dr. Bob Zufall retired from his urology practice, and he and his wife Kay launched a volunteer clinic for poor patients at a local church in Dover.
I think we saw half a dozen patients the first night we were open. It was 1 night a week, and then it was 3 or 4 nights a week, and then it was some afternoons a week, and it gradually developed.
Zufall Health Center is the family doctor for the communities that we serve. We are now in 7 different locations throughout 6 counties and are providing a host of health services, including primary medical care, dental care, behavioral health care, some specialties, a lot of supportive and enabling services. And what's most important is that when a patient comes to Zufall Health Center, they will be cared for in a beautiful facility by a physician or nurse practitioner or dentist who is among the best trained and qualified in the nation. And they will be treated with the respect that everyone deserves.
We have multiple groups that work together from all different backgrounds, from administrative staff to pharmacists to social workers to patient navigators to physicians, all working together, providing that team care into that experience of the patient is what brings something special to the visits and something special to our center.
If I have a teenager in distress, I go downstairs and I get the social worker. If I have a child with special needs, I have the patient care coordinator that helps me with all their special needs. So it's all kinds of things that I would not be able to do in private practice.
As doctors here will tell you, anybody who visits us quickly learns that Zufall is more than a health center, it's family. Even Governor Christie recognized that when he met a patient whose family has been coming here for years.
Here, a woman who's coming here for 20 years, she knows the doctors, she knows the nurses, and their ability to be able to appropriately diagnose and treat her is enhanced by that relationship. She said, "These folks are my friends." Well, that's the kind of people you want to receive health care from. We're doubling down on these community healthcare centers. We're doubling down on FQHCs. We think they provide us the best result for the dollars that we're investing for the taxpayers because of the holistic way that they approach all the different healthcare challenges that their patients bring in.
But it takes more than government funding to provide all the services our patients need. Zufall is grateful for the many organizations, foundations, and individuals that have been our supporters. However, to assure our future, the more people we engage in what we do, the better we will be able to continue to serve the community.
I would urge anyone who would like to share in supporting the effort to bring first-class primary medical care to people who otherwise might very well not be able to afford it. If you want to join in that effort, Zufall Health Center is the place to be.
We are looking forward to serving new generations and looking forward to great success in the next 25 years.
It's succeeded and grown, I would say, to use a cliche, beyond my wildest expectations. Really, it's just the biggest thrill of my whole life, frankly.
It's amazing where we have been, where we're going, and I can't wait to see where we're going to be next.